Good morning. My name is Aya Nguran and my topic is on ulcerative colitis. Ulcerative colitis is a long-term inflammatory bowel illness that affects the innermost linings of the colon and the rectum. It is a condition accompanied by mild to severe pains, depending on the level of infection, and leave the patient vulnerable to developing colon cancer and other threatening complications. It is therefore prudent to tackle the condition in its contemporary stages. Azathioprine and cis-mercaptopurine have been medically proven to be effective in helping patients with inflammatory bowel disease since the mechanism of action involves prevention of inflammatory by blocking the immune system. The first documented use of azathioprine in managing worsening ulcerative colitis was in 1966. There is data supporting the use in conditions There is data supporting the use in conditions when remission is a challenge. Maintaining the aminosalicate alone in moderate and severe cases where steroid aids in induction of remission. However, data data of use in treatment of ulcerative colitis is still skewed, making it a controversial issue in the medical fraternity. Some clinical trials have established that continued use of azathioprine prevents relapse in patients undergoing treatment of ulcerative colitis. The discontinued treatment is attributed to negative effects of the drug, including pancreatitis. In 1974, the first randomized double-blind placebo-controlled trial on the use of azathioprine was documented, creating precedent to several studies with inconsistent results. Since maintaining remission is a fundamental concern in inflammatory bowel diseases, there is a need to establish appropriate therapeutic remedy with required medical efficacy to the condition. The study objective. The study aimed at assessing the effectiveness of feasibility of azathioprine and cis-mercaptopurine in maintenance of remission of colitis. This will establish the medical efficacy of the two drugs, therefore providing solution to the medical condition. The study also aimed at establishing the adverse effects of using the two drugs, thereby ascertaining the safety of the patients where the drug are administered. Some of the adverse effects analyzed include acute pancreatitis, bone marrow suppression, neoplasia, jaundice, hepatitis. Lastly, the study also aimed at conducting a pooled analysis on the use of antimetabolites in cases where aminosalicide which have well-established efficacy fails or where induction is required using steroid therapy. In An important issue established through the trial was the relapse in cases where the use of the drug are determined, for example, due to realization of adverse effects. The type of study that are being used. The study was a randomized control test. It involves consideration of trial over the duration of 1 year. Comparison treatment were then administered with other active maintenance therapies, including comparison of azathiopurine or cis-mercaptopurine with placebo therapy. Comparison of azathiopurine with sulfasalazine. Comparison of cis-mercaptopurine with 5-SA. Comparison of 6-mercaptopurine with methotrexate. Comparison of azathioprine with cyclosporine. Comparison of both azathioprine and cis-mercaptopurine with active placebo treatment. All the above interventions were graded in 4 working groups distinguished by grade of evidence. The first group is high quality, where there is absolute confidence in the true effects, lying close to the estimates. The second is moderate quality, where there is a little possibility of substantial difference in the true effects of the estimate effect. The third is low quality, where the confidence level is limited, suggesting likelihood of the true effects being substantially different from estimated effects. And lastly, very low quality, where there is a very little confidence of the estimate. Open label studies were also considered to establish the efficacy of the two drugs in other medical circumstances. Generalization population. The sample population involved 302 patients diagnosed with ulcerative colitis, spread across 7 studies. This was then supposed to be extrapolated to all patients diagnosed with ulcerative colitis, so as to provide an overview of how they would react to the treatment. Since the presence of comorbidities were considered an inclusion factor, it shows that the patients with only inflammatory infection were targeted by the study. Additionally, the study also aimed at establishing the rate of relapse, evidencing the effort to establish the adverse effects of discontinued medication, a factor targeting patients who abandon the therapy journey before achieving full recovery. Moreover, the study involved analysis of clinical trials suggesting that the results are to be used by the medical professionals. This includes doctors who prescribe medication, pharmacists who oversee the drug prescription, and nurses who administer the medication. From the conclusion, the researcher can also be said to be part of the targeting population cortices for the role in conducting further research to gather more evidence, thus providing accurate data that can be used to ascertain the medical efficacy of azathioprine and 6-mercaptopurine in the treatment of inflammatory bowel disease. The study sample. A search was done in the Medline Embase and the Cochrane library databases. 1,082 records obtained from the literature review were analyzed and duplicates removed the remains with 840 trials. 2 authors then independently reviewed the data and ending up selecting 24 studies for further analysis. The independent selection were harmonized through consensus, including a third-party author. 14 of the studies were then excluded to remain, then 10 reports, of which 7 were included as there was a risk of bias, in the other 3 attributed to a lack of blinding. Bias in the results was assessed by the Cochrane risk of bias tool to ensure study quality. The tool examined the randomization generation sequence, the patient allocation concealment, cases of blinding, and complete outcome in selecting reporting. The main inclusion criteria was studies examining the efficacy of purine anti-metabolites in comparison to other active maintenance treatment in ulcerative colitis. A major exclusion criteria was the presence of comorbidities, where patients with active chronic illness were not considered in the trial. The overall quality of evidence backing the outcome was then used to grade the results. This was done using the grade approach, using 4 criteria to downgrade the evidence. There was also control sample guided study in which placebo was used in a placebo control sample and compared against aminosalicylates sample. The statistical analysis. Statistical evaluation were based on 2 outcomes, that is primary outcome and secondary outcome. Each study has calculation of the risk ratio for the primary outcome, that is the probability of relapse during the study, and the confidence interval done on 2 by 2 tables. The sample, that is outpatient, were randomized based on an intention to treat approach. Further analysis was then done to exclude primary treatment failure, including in induction period. The She2 test was used to check for heterogeneity in the studies. The value of phi was set at 0.01, where any value above was considered statistically significant, thereby quantifying inconsistencies. The above statistics account for variability attributed to heterogeneity rather than error in sampling. Value greater than 50% evidence significant heterogeneity, therefore pooled analysis was not performed. In case of the value lower than that, homogeneity was assumed and therefore pulled down with a confidence interval of 95%, which are calculating using fixed effect model. The last statistical analysis involved ascertaining sensitivity, which examine the effects of dosage, type of intervention study, quality, and the overall result of the analysis. The evaluation was done in 3 categories: calculating the ratio for withdrawal patient, including the induction period and the additional azathioprine to patients who have attained stability in remission. The result: azathioprine versus placebo, done in 4 studies, including 332 patients, 115 on azathioprine and 117 on placebo. 44% failed to maintain remission in the former, while 65% failed to maintain remission in the latter. There was no heterogeneity. P equals 0.60%, when 8% of patients experienced at least one adverse effect of the former one. Only 3% experienced the same in the latter. Azathioprine or 6-mercaptopurine versus 5-ASA or sulfasalazine sold 2003 encounter high degree of heterogeneity, therefore could not assess remission in the remaining 6-mercaptopurine and 5-ASA. The sample size of comparison of azathioprine and sulfasalazine was 25 patients, 13 of the former and 12 for the latter. 0.58% of azathioprine patients failed to maintain remission, while 38% of sulfasalazine patients failed to maintain remission. Adverse events were observed in 17% of azathioprine patients and 0% of sulfasalazine patients. All the patients were all the patients with adverse effects ultimately withdrew. Cis-mercaptopurine versus methotrexate. Sample consisted of 14 patients on cis-mercaptopurine and 12 patients on methotrexate. 50% failed to maintain remission in the former, while 90% failed to maintain remission in the latter. 21% of patients on the former drug withdrew due to adverse effects, while only 17% withdrew on the latter drug. Azathioprine versus cyclosporine. Evaluation on effectiveness of azathioprine and cyclosporine was done for 6 months while tempering the medication with steroid and 5-ASA for remissive UC patients. This was then followed by 12 months of observation period. At 18 months of monitoring relapse upon discontinuation of the medication, 50% of the patients on azathioprine failed to maintain remission, while 62.5% of cyclosporine failed to maintain remission. Each drug had a single patient experiencing adverse effects. Adverse events across placebo control and aminosalicylate comparator trial. No statistical significant difference in events of adverse occurrence upon pooling of the study, with no minimal adverse effects profile with placebo-controlled studies. 9% of azathioprine patients experience at least a single adverse effect, while 2% of control patients experience adverse effects. Upon pooling studies with withdrawal due to adverse effects, 8% were attributed with withdrawal due to azathioprine group and 0% from the control sample. Pancreatitis was witnessed in 3 out of the total of 141 patients on antimetabolites. Jaundice witnessed in 1 patient out of 127 on azathioprine, and bone marrow suppression reported in 5 of the 127 patients. Fortunately, death, opportunistic illness, or neoplasia occurrence were not recorded. Upon police studies on acute pancreatitis, 2% of patients in either azathioprine or 6-mercaptopurine developed pancreatitis compared to the 0% registered in the control sample. 4% of patients on azathioprine reported bone marrow suppression compared to 0.8% of the control sample. To conclude, an article had conclusion divided into 2 categories. Implication for practice. The authors concluded that azathioprine is a considerable remedy in the maintenance remission of ulcerative colitis. It is particularly important for patients who can no longer tolerate aminosalicylates, beside those requiring steroid therapy to induce remission. However, there is a minimal evidence to assess its sole superiorities or use in alongside standard maintenance compared to effectiveness when used with other active maintenance therapies, for example 5-ASA. Moreover, due to the potential to elicit adverse effects, it may not be best remedy to be used as the first line of treatment in case of ulcerative colitis. It therefore should only be used as the last option in absence of more convincing studies. Implication for research. The data currently available from the clinical trial may not be sufficient, necessitating more data, more from quality clinical trial that can be used to entirely assess the efficacy and safety of the drug in ulcerative colitis therapy to maintain the remission. The question that still begs further consideration is the appropriateness of anti-metabolite sparing therapy used in clinical therapy. That serves as the challenge to beef up research in order to exhaust the phenomenon, consequently eliminating controversies surrounding the medical therapy. I agree with this conclusion as medical procedures are extremely sensitive, requiring high level of certainty before analyzing a certain therapy in order to protect human lives. Therefore, an appropriate giving room for further research is the most prudent when evidence in the table is limited. The bias in the studies. There are several types of bias that may have compromised the result of the studies. They include selection bias. Even though the samples was random, the sample size was considerably small, suggesting that the group under study could have been underrepresenting altogether. This will give a false picture of the effect of azathioprine and cis-mercaptopurine in the maintenance of remission of the ulcerative colitis. Confirmation bias. The article involved selection of different studies conducted in the effect of the use of azathioprine and cis-mercaptopurine in the maintenance of remission in ulcerative colitis by two authors, suggesting that the interpretation of the study befitting including is left to the author. This suggests that they may intentionally or unintentionally choose information that conform to their premeditated opinion, hence reducing the credibility of the study. Publication bias. The publication was preceded by selection of trial using given criteria. This is this is in a bid to exclude trial with less significant findings. This introduced the loophole where even trials that are perceived as less interesting by the author are less likely to be published. All results are important, with even those having negative results equally important in fully understanding the research question. Therefore, if some information is missing, the conclusion may not be entirely appropriate as a result of a condition called publication bias. A possible limitation of the study. Even though the study had viable results, there are some factors that could have been given little consideration, thereby impacting the results. They include sample sizing. The sample sizing was considerably small, considering that the finding may not be extrapolating to all patients diagnosed with ulcerative colitis. The inconsistency in prior research study and the data collection. Recommendation. Applicability to the population of concern. The applicability of the finding to the target population was significantly dependent of the applicability of the result to clinical practice because that provide the scope for treatment of patients with inflammatory bowel disease. There is a significant clarity if it is needed. It is indeed appropriate to use azathioprine in clinical practice, and the method has been passed to future studies already. Prescription of purine anti-metabolites may be an option if 5-ASA agents fail. They may be used alongside with each other and even interchangeably. Additionally, the dose response relationship was now completely tackled, derailing the application of the treatment and to patient. Suitable study design. The study design used was case control clinical trial where participants were selected based on meeting the outcome status. This limit of extrapolation of the result to the general population. Therefore, a more appropriate will be cross-sectional study where the participant will be assessed in both the exposure and the outcome, therefore assessing the prevalence of factors such as adverse effects of the drug. Another advantage would be the ease in estimating the odds ratio of exposure and the study outcome. Here are my references. Thank you for your attention.